So my name is Kimberly Dow. Thanks for joining us today. And today I will be talking about smartphone addiction in adolescents. Okay, and before I start, I did want to give a special thanks to Dr. Erin Belfort. She did a lecture back in 2017 that inspired this lecture that you are about to hear today. I have no disclosures. So the objective today is to acquire a baseline knowledge of the social media apps that are currently being used among adolescents today. We're going to understand how social media and mental health are related, learn how to recognize smartphone addiction, how to take a social media history, and also the basic steps to address and treat smartphone addiction. This is the outline of what this talk will be. So we're first going to play a little game called Name That Icon. When I originally constructed this presentation, I was a little hopeful that it would be in person. So we've modified the game a little bit. So hang on for instructions. We're going to talk about how adolescents engage with social media, areas of concern, the diagnosis. We'll talk about how to take a good social media history. We'll go over some cases, the management, and some key takeaways and resources. So since we are not in person, I'm going to be showing some icons with specific apps, and then I'll have folks actually just chat in the box what those apps are or what they think they are. And I'll give people between like 10 and 15 seconds, depending how long it takes people to do this. So here we go. All right. All right, so we got Twitter, Facebook, excellent. Oh, you guys are on it. Okay, excellent. Such a hip crowd. Okay, so let me see. Twitter, Facebook, excellent. How about microblogging apps? What are these? Oh, we got things are bumping. Okay. Okay, there's some good answers here. Excellent. Just wait for it. What is it? Tumblr, Instagram, Twitter. Okay, ready? Video. Excellent. You guys are such a hip audience. All right, here we go. This is a harder one. I'm up in it. Dating apps. Tinder, Bumble, Grindr, Hinge, Coffee Makes Bagel. Strong work, team. All right, so Tinder is number 1. We have Grindr number 2. Number 3 is Hinge.
I don't know any of those.
Bumble, and 5 is Coffee Makes
I honestly
Bagel.
don't.
I will not be going into what makes these dating
Oh, I
apps
guess
different. You can ask
Bumble.
your friends for that, or kids,
Any
or
of those,
cousins, or somebody else.
I would have, see,
All right, so how about messaging platforms?
why no J swipe?
No J swipe.
Married a monogamous.
There we go. WhatsApp, WeChat,
WhatsApp.
WhatsApp, and Discord. Oh,
the other
John
one?
Stevens,
Discord?
so cool. How do you know these? So as my cousin would say, WhatsApp's for old people. GroupMe is for even older people. Discord is for cool teenagers. And WeChat is primarily in China, but also over here as well in the US.
Okay, so
Now, how about secret apps?
she's on 12.
The secret apps are essentially,
you're gonna be doing the
apps
set.
with more secure
Well, I guess I
features,
probably
so
don't have
requiring
her
extra
updated talk.
passwords or ways to identify that you are the
She's
holder
gonna
of this
edit
content.
everything, so they'll show up at the same
We got
time.
Signal,
But it's coming up.
strong work. What about the rest of them?
A new Signal.
Lots of people. All right. I feel like you might know the other one, so we'll go through them. So Vault and Signal are very similar. This is Calculator. So Signal and Vault are essentially just secure messaging systems, and Calculator is primarily for secure pictures, whatever you might think that means. And then last but not least, before we wrap up this part of the talk, is the miscellaneous section. Pinterest, Reddit, Twitch. Good work. Okay, so the first one is a little bit harder. So the first one is actually called Randonaut. This was actually the app that the kids used over at Alki Beach last summer that found the body in the carry-on luggage. So it's essentially a choose your own adventure app. Basically, you just choose what kind of mood or adventure you're looking for. If you're in a spooky, scary mode, or like a mood, or like a happy one. And so that's what that is. I don't know how it works. You could look into that on your own. Twitch is essentially like a video game streaming / like platform for folks to share their gaming ideas, strategies. Pinterest is basically like an online bulletin board, ways to tag or save ideas for recipes, decorations, etc. And lastly, we have Reddit, which is essentially a discussion forum. So thank you very much for humoring me with that. I wish I could be with you all to see who's feeling real hip and cool and who's feeling a little old or out of date. So now that we have a good baseline of what apps are out there, there's the question of how are adolescents accessing these apps? No surprise, the answer is smartphones. And so it turns out smartphone access is nearly ubiquitous among teens, while having home computers actually varies by income. And so you can kind of see on the right-hand column here, smartphones, there's a higher percentage of access versus a desktop or a laptop computer. And speaking of smartphone access, this is where the poll comes in. So we will see if it works. I was curious, how many of you have checked your smartphone in the last 30 minutes? So let's see. Oh, here we go. I'm not gonna lie, I did access mine too. Oh, and so we have a few other questions, and it looks like the poll is all at once. So you can answer the other questions as well. So how much recreational screen time do you spend on a screen per day? And then how much recreational screen time do you think an adolescent spends on a screen per day? I'm not going to answer the other two because I know the answer. I'll answer mine though. Okay. So I'm going to give it 5 more seconds. And I'll oh, here we go. Okay, so there's one person that hasn't. Good for you. And then in terms of how much recreational time do the audience members spend, we got a good distribution between about 30%, about 0 to 2 hours. We have 2 to 4 hours, 57. I suspect that these two numbers should be higher, but I'll just say that. And then for teenagers, we have a split between the audience. So let's find out what the answer is. It is 7 hours and 22 minutes. Pretty crazy. So on average, teens are using an average of just under 7.5 hours worth. And this does actually not include time spent using screens for school or homework. So something to consider. Okay, and of note, there has been observed differences in the amount of screen time in young people from different racial and ethnic and social economic groups. I wanted to kind of point out here, for example, teenagers from lower income households actually spend more time than higher income homes. In addition, African American and Hispanic Latino teens would use more screen time compared to their white counterparts. And that was about almost 2 hours more in some settings. And then among our tweens, there's a similar difference that occurs in household income and race and ethnicity, with additional variations based on the gender. So what are teens doing on their screens? They spend a ton of time. And what we have found in one of the studies in 2019 is that these media diets vary a lot. And so a lot of adolescents report spending times on their phones or screens, watching TV, videos. There's lots of gaming, social media, browsing websites, and then this other category, which includes reading, video chatting, and just content creation in general. And then in 2018, in terms of what they spend their time the most on, we have YouTube here being kind of the number one app or website that folks are using, followed by Instagram, Snapchat, Facebook. Of note, TikTok was released, if you will, back in 2016. I suspect that if we did a survey now, that would be on this list as well. Okay, so we've established that there are a lot of social media apps out there, and adolescents spend a lot of time on their phones. So what? Why does this matter? Well, what do teens think of their use? Based on a survey in 2018, teens have a pretty mixed view about social media's effect on people their age. So you can see here about a third of people say a positive impact. There's about 24-ish% that have concerns about bullying and other negative impacts. And then the majority are kind of neither positive or negative. Well, what do the creators of this technology, what do they think about their creations? Well, apparently, Silicon Valley parents and creators of tech, such as Steve Jobs and Bill Gates, have gone and had articles, interviews, basically about how these apps and these sorts of technologies are actually banned at their households. So what does this say about this technology that we all have access to? Well, what does this data show? Essentially, there is a dose-response relationship in smartphone and social media use, an increase in mental distress, self-injurious behavior, and suicidality among youth. The effects appear to be the greatest among girls. And so what are these areas of concern? What we are worried about is basically this high proportions of youth engaging in heavy smartphone use and media multitasking, if you will, with the resultant chronic sleep deprivation, negative effects on cognitive control, academic performance, and then also social emotional functioning. There's this concern for a possible gateway to other behavioral addictions or disorders. And there are also multiple virtual communities out there that can support, normalize, and encourage many of these risky behaviors, including eating disorders, non-suicidal self-injury, pro-suicide behavior, et cetera. And so I did want to give a content warning. There are some possibly triggering images coming up in the next few slides regarding body image and self-harm. And so this was actually a slide from the talk that I went to back in 2017 from Dr. Belfort. And so this is a inspiration gallery. And so there are lots of virtual communities out there that are really normalizing risky behaviors or unhealthy behaviors, such as eating disorder behavior. And this was simply me typing into YouTube how to safely cut yourself. And there were many videos and options available, basically teaching people how to hurt themselves. Some might say this is a way for possible harm reduction. No matter what you think or feel, this is what is out there. There is also a platform for people to share. So that's another point to acknowledge. This is a little side note for any ophthalmologists or optometrists in the crowd. I did stumble upon this as well. So basically the increased digital time that we're seeing as well near work and really limited outdoor activities has been found to be associated with onset and progression of myopia, so nearsightedness, which could potentially be aggravated during and kind of beyond during this COVID pandemic outbreak period. So just something to be aware of. Okay, so mental health, social media, what is the link? The pathophysiology behind smartphone addiction is thought to be similar to other use disorders in the sense that it's related to dopamine. And so whenever you're on your favorite app, basically dopamine signals can be going and increasing in your brain. So like getting a like notification or getting positive feedback on a post you did. So possibly similar to taking a hit of a drug. And so when you experience more dopamine after using social media or your phone, your brain identifies this activity as a rewarding one. And so you should keep repeating it. In some cases, social media can be a welcome for as a distraction, especially during isolation, whether it's due to a pandemic, your work, an illness. And so the more you engage, the more your brain will say, hey, you should keep doing this because it's helping to reduce loneliness. Some concerns, though, is what does this do to your brain? Can too much screen time change your brain? And so this is a question currently being asked by the Adolescent Brain Cognitive Development Study. So basically, they looked at brain scans of adolescents with greater than 7 hours per day of screen time compared with less screen time. And what they saw was essentially a thinner cortex in the kids with more screen time that wasn't in the subjects' brain scans that didn't have as much screen time. So this suggests that there may be a connection between screen time and brain development, but we can't really say what those causes are and if they're directly related, but it is something to consider. Another study did also show greater performance on mental and academic tests when screen time was less than 2 hours. And so this observation or this result basically was also done in the context of also eating right. So eating breakfast every day, having 5 servings of fruits and vegetables, and having at least an hour of physical activity. So that's where you hear that 75210. This is where that came from. And then another little interesting study I came across was a survey. It was only about 250 people. And it found that although sleep and sex were the 2 things that people like longed for the most during the day, the urges that would keep them up at night would be the urge to stay on top of social media networks. And those would actually be the hardest to resist, even greater than alcohol and tobacco. So there are a bunch of headlines saying Facebook, Twitter, more addicting than tobacco and alcohol. All right, so here we are. Social media is not necessarily the causally related to mental health problems, nor risk-taking behavior. However, in vulnerable adolescents, there seems to be a preference for unmoderated, non-professional sites and apps, which could be triggering or worsen risk-taking behavior. So now what? As PCPs, primary care providers, parents possibly, or current smartphone users, what's there to do? So the first step, like with many problems, is recognition. And so these are some of the things that you can look for, whether in yourself or in your patients: staying on your phone longer than intended, having others complain about your use and how long you're on there, neglecting your responsibilities, preferring smartphone use to in-person connections or activities, reduced productivity, defensiveness or secretiveness of your use, or depression when you're offline. So right now, there's not a formal diagnosis of DSM in the DSM-5. Right now, it's kind of considered a form of technological addiction, which is essentially a type of behavior addiction. So gambling, for instance, is probably the best known behavior addiction. However, there is a list of criteria that is being proposed right now that has a very high diagnostic accuracy. So continued inability to resist the impulse to use your smartphone, symptoms of dysphoria, anxiety, irritability when you're withdrawn from it, using your smartphone longer than intended, heightened intention to using or quitting smartphone use, and persistent smartphone use despite recurrent physical or psychological consequences. So how can we apply this in a primary care setting? It all starts off with a history. So consider taking a social media history the next time you're in a well-child visit or just in a regular checkup. So the standard what, when, why, how questions, just approaching it with curiosity. Taking one down position, so letting that adolescent really guide you in your conversation, and then listening for risky behavior, poor decision-making on and offline. So these are questions I've listed for parents and adolescents. You'll actually have access to this as audience members, so I won't go through this in detail, but I did want to list some resources here for you. And these are the ones for adolescents. So next are just a couple cases we're just going to quickly review. I just want you to keep them in mind since we just reviewed diagnostic criteria and then as we review management options. So here is Stephanie. She is a 13-year-old girl who presents to your clinic for a well-teen visit. For her history and exam, it's overall unremarkable. Her mom is with her and is essentially just expressing concern about the amount of time she spends on her phone. She doesn't really ever see her daughter without her phone. Her grades are fine, though. She's still participating in normal after-school activities. When you ask Stephanie, what do you think of your phone use? She says, I don't know. All right, case 2, we have Emma. She is a 17-year-old female presents to your clinic also for her well-teen visit. Both her parents are present and they are both concerned. So they report that she has stopped having dinner with the family. She's stating that she has lots of homework to do, so just retreats to her room. Her parents have also caught her on her phone past midnight. And when they tried to set a curfew and take her phone away, she stopped doing all schoolwork, she stopped eating, and she did not talk to them for a week. So what are the treatments for this? Big surprise, there are no medications available. There's really not any strong evidence-based intervention that's out there right now. However, there are some areas that have been looked into, and so cognitive behavioral therapy, mindfulness, behavioral cognitive treatment, motivational interviewing, exercise for rehabilitation, music therapy, specifically drumming, and art therapy. And so how can we as primary care providers and current smartphone users in general manage this without the use of formal intervention? So I took this in kind of 4 approaches. We'll talk about learning how to avoid triggers, learning how to use media and technology in a non-pathological way, acknowledging that complete abstinence is usually not a feasible long-term goal, and then social support from healthy reinforcers. So triggers. So recognizing that friends, family, schoolwork, isolation, and wanting to escape are all triggers. And I think these are all things that have been noticed during the pandemic. I didn't specifically look at evidence and studies during this time, but I think we just as individuals have noticed this increase. Learning how to use media and technology in non-pathological ways. So there are lots of tools out there also on your smartphone to help you and save you from your smartphone. The apps and settings on your phone that can lock you out of certain apps for a specific time frame. Let's say from 8 to 5, you're like, okay, I can't go on this phone when I'm at work. And so locking yourself out of those apps or having a timer so your app actually kicks you off after a certain hour. You can also consider just deleting the apps off your phone so that you're not on your phone the whole time. So forcing yourself those extra steps of, okay, if I want to check this, I have to go on the computer and log on that way. And then simply just having a screen time notification on your smartphone. So I think right now, like I have an iPhone, for instance, at the end of every week, I get a screen time notification telling me how much time I've spent on my screen and what I'm spending what I'm doing on my phone. And so why not abstinence? And so usually it's really just not feasible with our current culture, whether that's a good thing or bad thing, it's another story. But as you all know, it's just kind of become the standard and recognizing could be a negative impact on the social lives of many adolescents. And so what can we do for social supports? Specifically for parents, you should consider when do you want to introduce smartphones into your children's lives. So the average age now is actually between 10 and 11, which I think is pretty mind-blowing. And so one of the recommended ages to introduce it actually from one of the resources I'll share with you later is the age of 13, and that's for supervised use. Turning off screens during family meals and outings, setting a curfew for phone use, learning about parental controls and using them, and essentially avoiding screens as pacifiers, babysitters, or to stop tantrums. And questions for parents to actually ask themselves. So when thinking about your child's phone use, really considering evaluating how they're operating in general, instead of just, are you using your phone too much? Thinking about their sleep, their exercise, are they still spending time with family and friends, not on their phones? Are they using their screen times to stay connected to friends and family? And are they still being engaged with their schoolwork? So in general, just to kind of like sum up the approach at home, really starting with compassion. I think really under these extreme circumstances with everything going on with the pandemic, it's still very important to be aware of the role of what screen time plays in adolescents' lives and even our own lives, right? Because limiting screen time is so hard. Right now, I think thinking of your child's health or your own health in a more wholesome way and how they spend their time in general is healthier than simply just saying, oh, you spent too much time watching TV or TikTok. And so really starting with compassion, keeping a schedule saying, okay, let's spend one day a week where we're not looking at our phones. Model healthy screen use. I was at a restaurant. I remember there was an entire family from both parents to all the children. Everyone was on their phone. And so trying to set that example for your children or siblings or whoever is in your life. And then brainstorming alternatives. Let's go for a hike. Let's go for a walk. Let's cook together. Let's do something else together besides being on our phones side by side. And so some resources that I found really helpful was this website, specifically Common Sense Media. They have some really great stuff, not just for parents, for people in general. And so they had cell phone articles and about every topic that you can think of, really. And I do want to acknowledge it is not all bad. There are some really amazing tools out there for patients and for yourself as well as a smartphone user. So this is a eating disorder management app that is available, and it helps folks basically record not only what they're eating, but their emotions as well. Calm is really great for sleep and meditation, helping to lower stress, sleep anxiety, and hopefully helping people with better sleep. There's Mind Shift. This is a mental health app specifically designed for teens and youth, but it can be used for anybody, really targeting anxiety. And then this is called Quit That. And this is a free app basically used to help people quit any habit, whether that's drinking, smoking, smartphone use. Yeah. And so I think the key takeaways that I'm hoping you all will take from this is that adolescents do spend a lot of time on their phones, and we do too, probably. And management really starts at home and with yourself. I don't want people to forget about the 75210 for all well child visits. So even during, the newborn visit, the 1 month visit, reminding parents that they really shouldn't be introducing phones at this point in a child's life. And then considering the differences in the amount of screen time used in people from different backgrounds, whether that be racially or socioeconomically. And then future considerations I did not have time to get into today. Gaming is huge. There's a whole community, and that is a talk in itself. Smart speakers. Where does Alexa come into this? And then virtual reality. That is a booming area that is really interesting. And there's some cool research being done in that area as well. These are my references. And now I'm open for questions and answers.
So, this is a suggestion that wait until 8 is also a great resource.
Thank you, everybody. All right, and so Colin Shank, a former grad, is actually up next, and he'll be demystifying the methadone